Hi, and welcome to the Modesto Bees live Q&A on Halloween during COVID-19. I'm Deke Farrow, one of the editors at the Modesto Bee, and I'm here with Dr. ChrisAnna Mink, a pediatric infectious disease specialist and clinical professor of pediatrics at UCLA, and Dr. Danielle Johnson, a psychologist from the University of Kansas Health System. Dr. Mink is the Modesto Bee's children's health reporter on a 2-year fellowship through the Report for America program, an initiative of the Ground Truth Project. She's locally supported by the Stanislaus County Office of Education and the Stanislaus Community Foundation. A reminder, both Dr. Mink and Dr. Johnson are providing general information and not specific health advice. If you have a health concern, please contact your provider. As you know, the coronavirus pandemic has changed our lives in many ways, including how we approach holidays and celebrations. One of those is Halloween, where millions of children, young and old, dress up in costumes and go house to house in search of treats, usually candy, from adoring neighbors. This year, however, with social distancing, masks, and other safety measures to protect against contracting the deadly virus, Halloween has taken on a whole new meaning for children, adults, and those on the other side of the door, usually enthusiastic to see the smiling children on the other side. That's why we've asked Dr. Mink and Dr. Johnson to help answer your questions and guide us all through the safe practices in preparation for All Hallows Eve, which this year falls on Saturday, October 31st. I also would like to ask that if either of you, doctors, would like to expound on anyone else's answers, that's great. Also, Patty Guerra, managing editor of the Bee, will be here to monitor Facebook for viewer questions. So our first question goes to ChrisAnna. Chris, are there public health guidelines about Halloween?
Yes, very much so. The Centers for Disease Control has provided guidance for actually all of the fall and winter celebrations, and we're starting off the holiday seasons with Halloween and Dia de Los Muertos. And the CDC has ranked ways to celebrate or risk from lower to higher, and you can find that on their website at cdc.gov, which may come up in the chat for our viewers. The example of a higher risk activity would be traditional trick-or-treating. As a matter of fact, in California, traditional trick-or-treating has been discouraged by our public health.
We're going to stay with you, ChrisAnna, for this next one.
Okay.
Does that mean no trick-or-treating as the trick-or-treater or the household giving out candy?
The short answer to that is yes, it means no trick-or-treating. It's strongly discouraged. Even though these events are outside, they're considered high risk because of the risk of being in close contact in crowds with other people, which is a real risk for getting exposed or transmitting COVID-19. However, we know families are probably going to choose to go out because it's a big celebration. And if you do choose to go out, the recommendation is do it only with your own household and maintain social distancing. Definitely avoid crowds. And as I'm going to say many times, I'm sure during this session, remember your COVID-19 rules: social distancing, wear your mask, maintain good hand hygiene. And although that's going to be really difficult with little kids outside in costumes, it was a reasonable idea to keep using hand hygiene after each encounter with somebody else.
Now, at our house, we're super big into Halloween. We've had the decorations up for a couple of weeks now. Our plan has been to hand out candy in a socially distanced way, bagging them up in these little treat bags, putting them out on a table at the end of our walkway and watching from a distance as kids come along and take them. As far as plans go for people who just really want to participate, how does that sound?
As far as plans go, that's following as many socially distancing rules as you possibly can. It's reasonable.
Should I also put hand sanitizer out there with the bags? Or I just feel realistically kids aren't going to stop and pause and pump the sanitizer and wipe their hands and then grab a candy.
How about giving hand sanitizer as the treat? I know, spoken like a pediatrician, right? No, yeah. Using hand sanitizer actually I think would probably be more realistic to be on the parents or the adults traveling with the kids after they receive the treat from you, to give it to them as they are actually leaving your house. For you, as a homeowner, you may consider using hand sanitizer on the doorknobs or doorbells or things that are being touched by the visitors.
Got it. Dr. Johnson, we're going to throw this one your way. Any suggestions for those who are giving out candy?
So this is an important question. We have looked forward to this tradition of Halloween since last October 31st of 2019. And so finding ways to modify this. I know there are some communities that have been quite creative and they've made launchers of sorts. So they're launching the candy or catapulting the candy out to the kiddos and the older kiddos to make sure they get candy. Some are leaving bags at their doors just to be able to partake in this tradition in a safe way. So while most people that I know are going to find some different way to celebrate this year, they're being creative. Some are having like an Easter egg hunt, which they're leaving clues for neighbors to come out and kind of dig for candy in the yard, in which they've left it out and it's fine. They've got certain neighbors that are coming over to be able to get candy. So I think being creative, this not just Halloween, but for all of our family activities in this holiday season, finding ways of being creative with celebrating.
I love that idea of making it like an Easter egg hunt, hiding candy around. I mean, our kids wanted to do that well past the time that we thought that they'd want to. So it's a tried and true fun way of staying within the household, but giving them that treat.
Yeah, I would, if it's okay, I'd like to add, I totally agree with what Dr. Johnson said, but I'd like to add that if you are the person giving out candy, if you're going to do that live in person and looking closely to the being out, I encourage you to be outside and to wear your protective gear, at the very least to wear a mask, and definitely go with some of those clever contactless things that Dr. Johnson mentioned. You know, like you said, Deke, you're going to put treats outside and candy bags for the kids to pick up, and that way you have minimal contact. Some of those launchers and shoots that people are posting on really creative are really creative. I know our managing editor, Patty Guerra, is looking at putting bones sticking out of the yard with candy in hands for the kids to come grab them. So there's all kind of really, really fun opportunities to be clever and creative. You can find on Parent and creative websites. So go crazy.
Chris, yesterday you and I were talking about alternatives to candy. Some of the treats that are widely available as party favors. The little witchy finger extenders, pencil toppers, erasers, whistles, those kind of things. There are concerns that go along with that too. What are your thoughts on those? Either of you, what are your thoughts on those?
Since I'm up, I'll go first and just say I love those ideas, but remember to keep it age appropriate. So for kids under 5, it really be attentive to choking hazards. And a lot of times in the clinic, we'll use stickers for the little kids, and even some of the big kids like stickers. But yes, those are really fun things. It's for giving out as alternatives for treats. It's also a nice alternative for kids that have a lot of food allergies. So that's one of the things with Halloween that the American Academy of Pediatrics likes to emphasize. Don't forget the usual risks. Make sure that the kids are getting treats that you feel safe with them getting.
And let's go on about treats. What advice do you have for children who are out trick-or-treating, or for parents to pass on to their children?
One of the first things is don't let the kids eat candy while they're out. And it's along the same lines that it involves taking down the mask and putting their hands to their mouth to eat the candy. So there's a risk right there. The other thing is, again, like I mentioned, is just the usual risks of choking hazards and that possibility of exposure to food allergies, because little kids don't know to read the labels. And I know there are a lot of urban legends about poisoning and razor blades and stuff. Those are actually extremely rare, but it's still good for an adult to inspect all of the candies and all of the treats that kids receive. The other little tip is don't let your kids go out hungry. Fortunately, it's on Saturday this year, so you'll have time as opposed to like on a school night where you're running around after work trying to get everybody out. Make sure they have a snack before they go out, because if you're a hungry kid and you have a bag full of candy, you're going to want to eat it. I don't know, Dr. Johnson, is there anything else you'd like to add to this one?
Yeah, I really like the idea of adding different treats for Halloween that are non-edible. I think for many parents, there's a battle when you get home and your child has a bag full of candy and they want to eat it, and it's difficult. So it's nice to have some other options of the pencil toppers or pencils or stickers, or kids seem to really love tattoos. So getting some Halloween tattoos, but some alternatives that you're not so focused on eating candy and having a battle at night about eating copious amounts of candy.
For either of you, some people prefer to give out homemade treats and fruits, perhaps thinking those are the more healthy things that kids should be eating rather than the candy overload they're all getting out there. What are your thoughts on handing out and accepting homemade treats and fruit?
I have a strong opposition against that. I understand the idea behind it. And I think for some people, if it's your neighbor and you know them and trust them, it's a safe thing. And I think Earl was mentioning food allergies. And so having my own child with food allergies, I'm also then cautious of cross-contamination of what item may have touched another item that we're then bringing into our household for possible ingestion. So I think the idea is great. And I think for close family and friends in which you know that you would normally eat their food anyway. But I think as a general principle, it's safety that you don't spend time and maybe effort on something that's going to get thrown away because the families aren't comfortable with eating homemade items.
Yeah, I would add to, again, I agree totally, would add to that regardless of what children are offered, almost a live snake I might decline, but generally children should graciously say thank you to things. I mean, in my childhood, going out trick-or-treating was called Beggar's Night, and beggars should be gracious. However, like Dr. Johnson, I would really discourage families from bringing out fruit or homemade treats. It's just not something that is really going to be accepted by most families.
Dr. Johnson, over to you with this next one. How can parents or caregivers best communicate with children to keep them from feeling like they're missing out if they're not trick-or-treating, if they're not going to a party, doing some activity that they usually do, or have maybe long been looking forward to a first Halloween or a first, Yeah,
I think that's a really important question. And we've encountered that since March of this year. How do we talk to our children about things not being the same? And Halloween is no different than any other Halloween or holiday we've had. And so having open and honest communication that we've looked forward to Halloween for many months, and it won't look different this year. I think sometimes we try to change our language and not be kind of direct with our kiddos to say that we can't do things as normal and that's temporary, but to really acknowledge that things will be different, to validate and explore their feelings about it, because they will be sad, and that's okay. That's acceptable. That's understandable. So having the conversation of things won't be the same, validating and acknowledging their feelings, and then making some creative plans of how you guys can do it differently. We talked about some ideas earlier. An idea that I've seen is having a scavenger hunt in your home. So you've got stations in your house in which you've got the candy set up that they have to kind of figure out where the candy is at, and they get a prize and get candy. So really being creative of how to make this a different year in which the kiddo gets to lead some of that. And so they get to have some control and the autonomy to say, well, we can't do it this traditional way. So what are your ideas on how to make it different this year? And kind of reframing it that way, that this gives us a really cool opportunity to try something different that we would have not ever tried because COVID happened.
How might a conversation with a 4-year-old differ from a conversation with a 14-year-old?
Great. 4-year-olds don't have much frame of reference for Halloween. They probably don't remember much from being a 3-year-old and trick-or-treating if they trick-or-treated the previous year. And so 4-year-old is much more easier to shape of let's do something different that involves candy still, because they're all about candy, and still having a Halloween costume on, which will be an easier conversation. With the 14-year-old, there's going to be, I think, more emotional turmoil inside of not being able to do these things that they expected to do. And so I think the principle is still the same, that you still modify and adapt to ways that a 14-year-old can still have a fun time, whether that's social media or virtually having a Halloween get together with friends via Zoom, in which they all have their favorite costumes or all decorate a pumpkin together. There's ways of being creative, I think, with the 14-year-old that will work great. While they're still sad, you acknowledge that there's still opportunity. And with the 4-year-old, they're still more maneuverable to doing something different without it being a complete and utter meltdown.
Chris, one of the most frequent questions we hear from readers is, can we have, quote, normal, unquote, celebrations during this pandemic?
I get that question at home a lot too. The short answer is no. But it's really more complex than that. First of all, I say you need to know how extensive the spread is of COVID-19 in your community and what are the public health recommendations. Different communities have different rates. There are parts of, for example, California that it's almost zero, and public health hasn't made any big changes. And there are other places where the virus is widespread and we've had to make accommodations. In general, the rules would be for an in-person gathering, keep it small, keep it short, keep it outside. And again, since it's on Saturday, even in the cooler climates, you can do it in the daytime. Generally, it's not too cold yet for most of the US. These are outside, small and short, are rules that decrease the chance of exposure and spread of COVID-19. And I would really, really encourage and remind that the lowest risk is celebrating only with your household members. And remember, your household does not equal family. That's really hard, especially in a lot of cultures. Household is family. If you're having a party, grandma, cousins, aunties that you don't even have blood relationship to, everybody's supposed to come. Not this year. Household means people that are in your cohort that live in your house. And remember, if you do have any in-person gathering, that you need to still maintain my echo again of the COVID rules. Mask, social distancing, and maintaining hand hygiene. Use soap and water when you can. If you can't, then use the alcohol-based hand sanitizer. And a big thing is if someone has COVID-19, has been exposed to someone with COVID-19, or has any symptoms, they should maintain quarantine or isolation, meaning they should not be around others.
Dr. Johnson.
Yes.
This pandemic has taken away so much from everybody, but when we're talking about kids, it's taken away so much from children from their first year of school to their last year of high school, from their sports to their birthday parties, to their scouting activities, to pretty much everything.
Yeah.
What advice would you give to a child who feels that this is one more blow, one more thing being taken away from them this year?
My first thing when I meet with kiddos is say, I'm really sorry this is happening. This is really sad, and really talk about feelings and how this is really hard and difficult. And I want to then ask, how are you getting through this? What are you doing to get through each day when you are missing all your sports? You're missing seeing your friends on a regular basis. You're missing things in this world. With a segue to, okay, you're missing all these things, but you're getting through it. How are you getting through it? And they give me some skills they're using or some activities they're doing. And then I want to expand on, okay, so this is going to keep going on. So how do we think about Halloween? How do we modify it to make it kind of cool Halloween? When we think about Thanksgiving and other Christmas and Hanukkah, what do we do to celebrate these things in this different and special way? So I've really been focusing with kiddos on how do we create these new traditions? How do we really celebrate these new things while still reflecting on the fact that we've had a lot of losses? Because kiddos have missed out their graduations, they've missed out high school or kindergarten graduates, they've missed all those things. And so being able to have kids write or draw about what they would have done and what that would have looked like and how they're going to make it look different next year. There are lots of kids who are planning to have more formal ceremonies for things they would have normally done this year, next year, just to honor what they would have done in a more celebratory way.
So this season is considered Halloween season by a lot of families. It's considered harvest season by a lot of families. And it's all about Dia de los Muertos for a lot of families. How would you suggest parents help children who are celebrating Dia de los Muertos, especially during this year when so many families are already dealing with losing loved ones to the pandemic? That's for either one of you. Sorry.
Okay.
Go ahead, Dr. Johnson.
Okay, thank you. The same idea of tradition. What do we do with our traditions, and how do we modify it and create new ways of celebrating those that we've lost? This has been a hard season in that for some of the people that have passed away, we've not had our normal ceremonies around that loss because of COVID. And so what do we do to help honor that, still modify? So for me, I'm talking a lot to kiddos and to parents about how do you do these celebration traditions at home? What things can you create? Which is a beautiful thing because you get your kiddo and you doing this joint activity together that pre-COVID, we didn't have a lot of time or space for. So we now have this time and space to do things together collectively as a family unit for those that all live together, to really celebrate and honor people. And we can do that with activities that your children gets to lead and kind of set up for you. So I think it's really important to carry out those traditions in a modified way and allow your kids to help make new traditions that get to honor and celebrate those that we've lost.
Chris, any other suggestions for explaining to kids that there won't be the usual celebrations this year?
I will again echo some of the things that Dr. Johnson said, that try and discover new traditions and ways to mark major events. And actually, interestingly, the American Academy of Pediatrics has said, look at this time as a way to role model for your kids on dealing with disappointment. And just one, discussing your feelings, like, yeah, I'm really disappointed that we don't get to do this, or, for Dia de Los Muertos, we don't get to go to the graveyard with everyone in our family to celebrate our loved one. We just don't get to right now, but there are other things that we can do. So the Academy really suggests modeling, discussing your feelings with the kids, and then being optimistic, even excited about the new ways that you're going to come up with things, and letting kids take the lead as much as age appropriate for them to do things. The AAP, the Academy of Pediatrics, has a website just for parents at healthychildren.org that lists some ways to talk about things and other ways to mark the events. And while I'm talking about the pediatrician group, Deek, I'd just like to mention that they do remind everybody to not forget the usual things for safety during Halloween. And I mentioned some of those before, but to just emphasize that, to make sure that the costumes are safe. If the kids go out at dark, that there's reflective strips on them, that their shoes fit. Because I remember a lot of times little girls like to wear the little princess costumes and the little heels. And the boys would like to wear some of the superhero things on their feet that are just don't fit right, and that's not safe. And also some of the costumes are too long, which is a tripping hazard. And also try to avoid makeup that's non-toxic. I mean, that is toxic. Make sure you use non-toxic makeup. Thank you.
I want to piggyback Dr. Mink, because when she mentioned what the American Academy is talking about with how parents model, there was a study in Italy this summer when they were deep into their quarantine and really dramatic lockdown for safety, that in their study, they were looking at child psychological well-being. And the biggest predictor of how kiddos were doing was not their access to resources while they're in quarantine, or the length of quarantine, or proximity to other resources. It was the parents' well-being in response to the quarantine. So parents who are able to model really good coping skills and have these emotionally laden conversations with their kiddos, those kiddos did better with their own psychological well-being. So it's really important as parents that we're able to have some distance between our level of stress and what we project with our kiddos, because they obviously hear it, they see it, they feel it. And so that was a really interesting study that I think they had one also previously in China that had the same kind of findings, that parents' well-being and ability to cope with distress impacted their kids either positively or negatively.
Thank you. Let's jump back to costumes for a moment. You were talking costumes and non-toxic makeup. What about masks? Are Halloween masks at all protective from COVID?
I'll take this one. That is a great question. And the answer is no. And this was not not a complex no, it's a no. Costume masks are not protective. If kids are wearing costume masks, they still need to have a protective mask on, like a disposable surgical mask or a cloth that's over their nose and mouth, because that's how the virus likes to get in and attack you. The other thing to do about this is, if there's only so much that a kid is willing to keep on their face, is to make a costume that incorporates wearing a mask, like a surgeon or a superhero or a firefighter. They're again, this is a chance to strut your creativity on how you have your kids out and being protected.
While I've got you on the screen, in recent years, there's been a trend of not trick-or-treating, but having Halloween events at schools, gymnasiums, other places where parents feel the kids are probably a little safer than just running around in neighborhoods. Should this be discouraged as well as trick-or-treating this year?
Yes. Indoor large groups should definitely be discouraged. That's the indoors, especially without good ventilation, large crowds. Those are probably the highest risk for transmission of the virus. Because remember, a big part of the problem that we're having with COVID transmission is people without symptoms can quite effectively spread it to others. So somebody who may be fine sitting next to you or dancing with you can give you the virus and you wouldn't know it until 2 to 14 days later. So strongly discouraged for large indoor gatherings. I have a little caveat in that if they're already in the classroom wearing masks with some of those kids, that's a cohort that they're already in, then that would be acceptable. But definitely not large crowds in a gymnasium for a dance with people that you don't usually hang with.
Now, this next thing I'm going to ask you about was not at all something that was around when I was a kid, but it seems to be very popular in these parts and in many others. And that's what they call trunk or treat activities, where cars gather in parking lots and I literally pop their trunks. And I think they're all vetted, but the idea is kids go around and get treats out of trunks. Can that be done safely this year?
Dr. Johnson, you want to go first on this one?
Yeah, the recommendation, and CDC has that, as Dr. Mink said, with the high, medium, low, and that's still a higher rating for risk of COVID because, again, you have kids and families grouped together. We have those here in Kansas, and they're quite popular, and you'll see hundreds of families out together, not socially distanced, and so the idea is that you're still not socially distanced. There's sanitation of, like, if you're washing your hands in between, and often you're not, it's not deemed safe. And so I know there's been a fair amount that have been canceled here for that reason, that there's concerns about the risk of transmission and is it worth it, or can we modify how we get kids candy and celebrate the season?
Anything to add, Chris?
I'm with her and with you because we both grew up in the Midwest. I never heard of trunk or treat before, and I don't even know that it's that big of an event in California now, but the CDC says high risk because people gather, and I would stick with their advice. And while we're talking about it, I forgot to mention earlier that for people coming to your house, it might be good to even mark 6 feet apart with some spooky markers or something to keep them, the visitors, the trick-or-treaters, spaced at your door, kind of like you've seen it outside of grocery stores or whatever, where you have to wait in line. And again, that's important to maintain social distancing. Even though we know the virus can live on other surfaces, the main way of transmission is from person to person. And maintaining those COVID rules is your best way for protecting yourself.
Thank you. So we've popped a lot of balloons today, telling people what they mustn't or shouldn't do. What are the alternatives? Let's talk a little bit about what they can do to have some fun. Chris? Dr. Johnson.
No, Dr. Johnson, you can go first. That's cool. Yeah.
Sorry about that. I think I'm not a horribly creative person, but for all the people that love Pinterest, the sky is the limit with what you can do right now. And we are not just relying on what we've always done the last 100 years. We can do pretty much whatever we want, safely, socially distanced, masked up. So we have an opportunity now to do things different and be creative. I really have appreciated the fact that although COVID has really impacted what we've done, it's given families a really good opportunity to reconnect. and not be running from sport to activity. So now that we're reconnecting, let's talk about ways of doing things a little bit differently. Do we want to have a Halloween pumpkin hunt instead of an Easter egg hunt this fall? Do we want to get different colored pumpkins and go crazy with pumpkins and decorate because we now have time and space and maybe we won't be trick-or-treating? We can really do kind of anything and get creative with setting these new traditions. And that's really cool because in 2021, we can incorporate what we've done from 2019 before and 2020 and make some really cool traditions that hopefully will go down and be passed along to kids and grandkids and just make it really unique and fun. And I think documenting, so taking pictures, recording all this to reflect on not just how hard it was, but also some of the cool things that came out of more time with family, I think will be a great opportunity for families.
I would agree that I'm not much of a creative person myself, but it's been really fun to see all of the things that families are coming up with. I love the shoots for giving out candy, and doing like a hunt around the house. And there are some socially distant things you can do with your neighbors. For example, have a costume contest or a parade with the kids, socially distanced, or decorating their bikes and their wagons, keeping 6 feet apart, walking down the sidewalk in their neighborhood with people you know and trust, 6 feet apart. Have a movie sit-in with playing an age-appropriate movie, nothing too scary for little ones, where the kids are 6 feet apart sitting in hula hoops, or have a costume contest on Zoom or whatever video conferencing software you use. There are really lots of clever people out there posting, and I would encourage you to search to find some of those things. And I really love Dr. Johnson's suggestion of writing about it. Obviously, being in journalism, documenting those things and letting the kids tell their stories, it's going to matter. Because think 100 years later, we're still talking about the Spanish flu from 1918. 100 years from now, people are going to look at, well, what did they do in 2020?
Yeah.
We have some questions from our audience for either of you. From Marcia. Our kids are back in school wearing masks, being around other kids. So what's the harm in putting out a table with treat bags in the driveway?
As long as there are no cars in that driveway, it's probably okay. No, just kidding. Yeah. Again, socially distanced, that sounds like a reasonable plan to me if you choose to have treats out there. Some people are worried that one big kid's going to come steal all their candy. If you're worried about that, just put a few things out and replenish as they're taken, with, again, maintaining the COVID protective rules.
And I will say for many people that have kids that still trick or treat, that's been done historically. I think for many people that I know, they will set their candy out because they want to be out with their own kids trick or treating. So I think that's something that's probably happened a lot, that I think at 9 o'clock at night, whatever's left over, the teens do come and grab what's left. But I think that's a modification of being able to celebrate. And if you do worse, as Dr. Mink said, to put out 20 and then replenish as needed.
Another reader, Regina, wants your thoughts on their use of a touchless candy distribution. She wants to know if it sounds safe enough to be using a 10-foot-4 pipe and placing full-size candy bars in goodie bags and then putting them down the chute.
I'm going to Regina's house. That sounds good.
Yeah, I'm going to. Sign me up.
Regina, please post where you are. No, actually, again, it's maintaining that social distance, and that's as reasonable plan as any in my view.
Yeah. No, I love it. I think that's a great idea. And I think for those like engineering type folks that want to spend 10 hours this week making their launchers, that sounds super fun. And I think kids will love that. Kids will love to go to the house that's like catapulting candy towards them. So I think that's really a cool way of getting the kids excited, but also giving them a really cool treat.
Great. Thank you. And from Myra, if there is to be safe trick-or-treating, is there an app or a website that maps out homes that are going to be handing out candy?
I don't know of anything national.
I don't know national. It's most of those things are local. I'm told that next door has some of those things that are placed. A lot of times we're used to seeing like malls having events saying, come get your candy here, or different groups, local groups doing it. But I think, again, the best way is to just search what's local. You can also talk to your local Parks and Rec department to see if they know what's going on. But for specific houses, the only one of which I'm aware is next door. But I think there may be some others.
I think maybe your HOA, I don't know if she's got an HOA that may post things on the HOA website for the homeowners association to make that know that certain houses are going to do a certain color light to indicate that they're open. Or if I know there's been some HOAs that as a homeowners community, they've made a decision to have stations set up or to place candy in some kind of strategic fashion to maintain social distancing. So she may check with her homeowners association to see if that's an option too, to know.
That's a good thought. If nothing else, I know there are sites out there that at Halloween season and at Christmas season guide people to kind of must-see spots for decorating. So I suppose even if trick-or-treating isn't in a family's plans, if they can find a good guide to some really spectacular Halloween displays, they could have a nice time, just like they do around Christmas, driving around and checking out the spooky sites.
Yeah. And also
eating candy.
Yeah, and don't forget the options of socially distant like mazes and pumpkin patches and going out carving pumpkins and those kind of things that are sort of more community based but socially distant, as I keep saying. I would also put in a little pitch for some reverse trick-or-treating. I know there are, and what that means is you put on your costume and you go out and you leave treats, and you leave treats for groups that are particularly in need, such as at senior homes, first responders, people that can't get out easily. UNICEF is continuing with their Trick or Treat for UNICEF, where they're doing it virtually for a fundraiser. And Operation Gratitude, they collect any leftover candies or candies that you just want to donate, and they send it to active duty military personnel and to first responders. So not only are they fun alternatives, they're socially conscious and help others that really probably are in need.
Questions come in for Dr. Johnson. Should parents be particularly mindful of Halloween changes, cancellations, hitting any particular age group harder than another?
I think the population that we're seeing in the data, and then I'm inpatient psychiatry most days, and so just seeing anecdotally who's admitted to our hospital, it's our adolescents, so our 12 to 13 and up kids are struggling more. I think they've had much more of an impact with the things they can't do. For most parts of the country, elementary age kids are back in school and doing that kind of either full-time unless parents have opted for remote. For the Kansas, Missouri area, we're just seeing a lot of our middle schoolers and high schoolers going back to a hybrid model of school. So I think that population has had the most impact. They've not had the social interactions because they've not been in school, and Zoom doesn't quite satisfy it for them. And so for the elementary kids, they've been less impacted by that. So I think that's the age range that's more impacted by another loss that they can fully appreciate versus a 7-year-old not really fully appreciating what he's or she has not been able to do this year. And so that age group is more impacted. And so again, being creative and finding ways to do some plans. And I think for most parents, this is month 6 or 7 of COVID. We've, I think, gotten used to telling our kiddos, hey, we're going to plan for this, but something may change that changes our plans. And so I think having that conversation of we're planning for X, but Y might happen, just to kind of give them the heads up that what we plan to do may change. And we can reflect back on, when we planned to go on spring break and that didn't happen because of COVID, we may have some other plans that fall through because of COVID, but don't worry, we will try and accommodate next year or in 2022 to do these things. So giving kids a heads up, I think, is going to be a big thing, that things might not go the way they plan to do it. And then having some backups in the back pocket to kind of modify what things are done.
Thank you. Doctors, is there anything more either of you would like to add? Questions that you anticipated that weren't brought up, things that have popped into your mind that you want to share out there?
I do. again, this taking off or adding on my pediatrician hat for a few moments, get your flu shot. A little rhyme that we use is flu before boo. It takes about 2 weeks to build up good immunity against influenza. And, we're all public health experts are very concerned about COVID, and we're having a little bits of surge around the country with COVID cases. And flu season is looming. It usually comes around Thanksgiving. So has happened as early as Halloween. So I would really encourage everyone out there to, everyone over 6 months, to get their flu shot. Flu before boo.
All right.
Dr. Johnson?
Yeah, I would add, we've seen, so I'm in patient psychiatry most of the time, and we've capped our admission due to social distancing and having single occupancy for our rooms. And we've maintained a very high census for the last 3 to 4 months. And so something I'm making sure I tell parents and my own social group is to make sure you check in with your kiddos to make sure they're doing okay. Often kiddos will have some changes in how they respond to you. They'll be more irritable or more cranky. Maybe appetite's a little different. So make sure that you ask your kiddo and you check in on a regular basis. Even if they seem to be functioning fine, check in and get that dialogue going. So if their mood were to change, you've already set the foundation for knowing how they're doing, and they know what words to use, and they know that you're there for them. So check in on kids as we get into colder seasons and the risk of COVID being increased, and kids that are in school may get put back on virtual. The chances of their moods changing is going to be higher. So that's something I've been telling everyone for the past 6 months. Check in on your kids, ask how they're doing, ask what's going great, what's not going so great, and have that dialogue so they know to come to you if things were going downhill and they're not feeling very safe to themselves or others.
Deke, could I add to that too? This is a self-serving plug. I just wrote an article today at modestob.com, modb.com, about suicide and rising mental health issues, especially for young people, 10 to 24. And the COVID we were already having an increase over the last couple of decades, but COVID has really been pushing everyone to the limit of their mental health, including adults, but adolescents and young adults seem to really be in a position of extra struggles, like Dr. Johnson, from all the losses that they've had. So I would not only check in with your kids, but if you are a kid or anyone of any age who's struggling, reach out, ask for help. People still want you in their lives, and that, we might not get to do the usual things this year, but there are lots of things that we can do, and that there is someone there for you. I don't think this is a time to think about giving up fun. I see that's one of the questions of why should we care? Halloween's just for fun. We need fun. Kids need fun. It's a part of their lives. And so why Dr. Johnson and I joined you today, Deke, is to try and help families to find ways to have fun. And that helps for everyone's mental health.
Beautifully said. I think we need the fun more than ever. As an adult, I want fun. So I find fun in my own kids, but I want to have fun, and I want to create some new ways to doing things. If that's exploring kind of my own thing, we'll find different donut places to go to just to try something different. It's drive-through, or they're not going inside, we're socially distanced, but finding small little things. So some of the fun things aren't huge. They're not these big things. It's spending $5 on some donuts, but trying something different and having something to look forward to. So if it's donuts on Sunday, great. If it's knowing that we're going to get a new coloring book every 2 weeks, if it's knowing we're going to get the new book series that's coming out, great. So finding these small ways of looking forward to something, because right now we're having a hard time looking forward to stuff. And so finding the small ways to look forward to it. So the more we do, the more we know. So we'll have warning signs that our kiddos aren't doing good. And to Dr. Mink's point, at our hospital, we're seeing many more kids that are having serious attempts that luckily they're not successful in, but we're getting kids in inpatient psychiatry that are just sicker, and they've had a serious attempt that they luckily weren't successful in. So to her point, we are definitely seeing that on the inpatient admission side.
Okay. We're having some more comments come in. Obviously, we're living in a nation right now where there's a lot of different schools of thought on how to respond to the pandemic, how much to respond to it. You see that in everything from masking to parents wanting their kids to go back to school to parents not wanting them. Some of our readers are asking, why should we be worried about trick-or-treating when people are able to fly on planes, eat in restaurants, and any number of other things? Why can't our kids have fun? Really, how bad can this be?
That kind of leads in from what we were talking about. Yes, your kids should have fun. Everybody needs some fun, but do it as safe as way as possible. On planes, they're supposed to be maintaining the socially distanced. Not everyone is following the rules, but that's what is recommended. And if you're going out trick-or-treating, maintain your COVID rules, maintain your social distancing. This virus is evil, and it is the scariest thing that we could possibly deal with for Halloween or any time during the year. So do the things that we know from science that help to protect you and those around you. Wearing a mask, social distancing. And those reasons those things work, there are actually data that wearing a mask not only decreases your chance of spreading the virus out, it does offer some protection to you. Obviously, the N95s that are reserved for medical personnel and first responders, they're called N95s because they block out 95%. But surgical mask and cloth protections, face coverings also have protection. So do the things that are in your control, which is also something that helps build resilience for children, is what is in their control. And they can learn very easily about the values of face mask and social distancing and hand hygiene. Let's do them and have fun.
Yeah. And I'll add on to that. I find that our children are much more resilient than a lot of adults that I know. They are much more flexible. They can modify quite easily. And so for many kiddos, by saying, you know what, we can't do the normal trick-or-treating thing, but I'm going to offer you this. Most kiddos will get sad for a little bit, but they kind of bounce back quite nicely. Parents may not bounce back quite as effectively, but they bounce back quite nicely. And so back to your original question, I think it's all about risk. Pre-COVID, would you let your kid ride without a car seat? No, because that's too risky. And so I think the same idea Dr. Mink's saying, it's all about risk and reduction of risk. So we can still have fun and do things. It's doing it in the safest way possible. And I'm beating a dead horse, but being creative with what we do with it. And there's so many opportunities to still have fun, to have a modified Halloween celebration while being safe, because we want to all be here and be healthy this time next year and not expose ourselves needlessly.
Thank you. Unless either of you has anything to add, we're going to wrap this up.
So, Deke, what's going on at your house for Halloween?
Well, I can't go sit out and scare kids like before because I have to be composed. And I realized I didn't need to decorate the house right up to the door because I'm not going to be inviting them to the door. So, they can be scared by the skeletons and spider webs and big giant spiders out in the yard, and they can pick their candy up off the table while we wave from the porch.
It sounds fun.
Yes. I mean, there's other stuff going on. We are doing the family activities. My son and his girlfriend are building a kind of like the Halloween version of a gingerbread house. Scary,
cool.
haunted house. So I can't wait to dig into that. And we're going to do pumpkin carving. So it's still very much going to be a fun Halloween.
Good.
So, doctors, thank you so much for joining us today and giving your time to share with viewers your tips and insight on what's going to be a very different Halloween experience this year. And to our viewers, we hope you have a fun and safe Halloween no matter what you end up doing. Good afternoon.
Thank you.
Thank you.